Will you tell me about AlphaFlo?
So I was brought onto it by, she was actually one of my clients, again, now friend, but she has agility dogs. But she was like, hey, have you heard of this? And I was like, no, what is this? She's like, oh, it's essentially like a stem cell derivative. And I was like, interesting. They harvest the placentas and cord blood, which they have to put through a filtering process because it's a really gross dark greenish brown color, and nobody wants that to be injected into their body.
And they're from animals.
Correct.
Okay.
So it's, from the cord blood and placentas of baby puppies that have been born. They've all been screened for any infectious diseases, and they basically put it through a filtering process, and it makes these really potent anti-inflammatories. There's interleukins, there's tissue growth factors, angiogenic factors, and it'll actually, instead of putting fibrocartilage, which is more of like a scar tissue cartilage, it'll make new hyaline cartilage, which is way better for longevity and kind of that management in the joints. So I was like, okay, well, let's see how this goes. And I reached out to the company, and they're like, here, we're just going to send you some vials to just play with it. Let me know how it goes. If you have any like medical, like, okay, I've tore my ligament in my knee. I have an ACL tear, but we don't want to go through with surgery. Let's try that. So I had one that I did that on, and it's been almost a year now, and I have not seen her back, and she has not been limping since.
Wow.
So I was like, all right, well, there's that. That's a cool one. And then we had Whaley. Had horrible wounds, ended up getting a really resistant infection. And I mean, her original one was like this big in between her shoulder blades, and she had one about that big on her elbow. So we had like a 2 ml vial, and I was like, hey, Dr. LaFlock and DeMello, do you guys just take it, inject it, see what happens? Mom was tired of doing surgeries because she had 3 or 4 of them, I think. So we just injected around the margins of the wound, and I was like, it was insane. Nothing else was done after that, and she was able to not have any other procedures. It's antibacterial, it's antifungal, so you can technically use it in a septic infected joint, and it'll actually help that process. But I think I'm up to like 65, maybe 70 injections that I've done since we've gotten the product. I think it's way better than PRP, personally. They don't have to be under full anesthesia. You just sedate them, pull it out of the freezer, thaw it, inject it. Usually their lameness is gone in 3 to 7 days.
Wow.
Fairly consistently. I've done it on a couple post-op TPLOs, my dog and one of my friends that introduced me to it, and he was literally weight bearing that night. So that's why we're doing the TPLO study with them to see like, okay, is there a difference in their return to function? Are they going to be walking the next day? Then also, is that bone going to heal faster? And then also kind of down the road, is it going to help prevent that arthritis formation? Is that going to be something that's going to be a game changer for these surgical cases?